Ipratropium bromide. Common trade name for it is Atrovent. It is an anticholinergic. So the way it works is it blocks the acetylcholine receptors in the bronchi, resulting in bronchodilation, reduced bronchospasms, and a reduce in secretions there in our airway. Pregnancy class for it is B. Indications for it: persistent bronchospasm and COPD exacerbation. Use it for that. Contraindications: if someone has an allergy, of course, to ipratropium or an allergy to atropine, they kind of work in the same way, very similar ways, I should say. So if someone has an allergy to atropine or alkaloids, then we need to use caution and try to avoid the use of ipratropium. And also use caution anybody who's allergic to peanuts, especially with the kids. There's some links between it, so sometimes some patients might have a reaction to ipratropium if they're also allergic to peanuts. Of course, we all know how to fix allergic reactions. We can give them some Benadryl, but if we can avoid it, let's do that first. Adverse reactions to watch for: headaches, dizziness, nervousness, tachycardia, palpitations, nausea, vomiting, dry mouth, cough, all that good stuff. Not really any major drug interactions to note. Typical adult dosage is 0.5 milligrams, and that's going to be nebulized. Typically we mix it up with our albuterol in our nebulizer and do them, go ahead and give those together. For the kiddos, 0.25 milligrams nebulized as well. Starts working in about 1 to 3 minutes, peak effects in 1.5 to 2 hours, and the duration is 4 to 6 hours. Something to keep in mind, we're giving this with albuterol typically, and so albuterol is a beta-2 agonist, whereas ipratropium is an anticholinergic. So they are both working to expand the bronchi and relax the bronchioles and get more air into the lungs, but they're working on two different mechanisms, two different body systems, or they're working two different ways to achieve the same results. So that's why we use them together. Some patients don't respond well to beta agonists, other ones don't respond well to anticholinergics, but sometimes together we can hit all the points with that. So that's why we give them together.